My last question, and I know this is tough, but how do you work to improve a patient who is struggling with that short-term memory?
Yeah, memory is one of the hardest things actually to work on. And so a lot of times the memory may not improve fully, but we can give them strategies actually to work on. And so it's kind of the same thing, going back into their home environment, maybe school, maybe work. We do a lot of different strategies. It may be one, using a memory notebook, something that they have with them that they can look back or write down notes so that they don't forget. So that is probably the number one thing, is writing down things. We do making lists, maybe before they didn't have a to-do list for the day, or they may not have done grocery lists or things like that. So writing things down is very important. We also do things, maybe setting alarms on their phone to help them remember appointments or taking their medications. So all those different types of things, including all the visual reminders, which are needed.
And we are joined now by Rhonda with Occupational Therapy. My first question is very basic, is that how does occupational therapy benefit patients who have had a traumatic brain injury?
Well, occupational therapy works on those day-to-day things that everybody takes for granted. So it's things like getting dressed and grooming and those types of things. And so with a brain injury, we start off with the real basic things. So we'll start off with grooming and with eating and dressing and toileting. And when they start to get those things mastered, then we move on to higher level activities such as cooking or laundry or managing their medications or managing their schedule for the day and those types of things.
We are joined today by Maleeka. First, can you just briefly tell us what kind of treatments patients with traumatic brain injury will go through in a physical therapy standpoint?
Yeah, so physical therapy, we focus on getting patients home. That incorporates making sure they're safe at home, including getting in and out of bed, going from a sit to a stand, walking, going up and down stairs if they have to navigate them at home. Also, it could incorporate wheelchair mobility if they can't walk, making sure they can get around in the wheelchair just fine on their own or with supervision from other people. We also incorporate balance and leg strength, coordination, all different kinds of things, focusing kind of on the lower half of the body.
What are some challenges that are unique to TBI?
There's a couple of things that are unique for them. The fact that to recover from a traumatic brain injury, we need to stimulate the brain, as well as also giving it rest to build the heal. So the perfect combination of trying to stimulate it while also trying to let it rest, which can be a struggle sometimes, knowing the happy balance between the two.